Hi, welcome. Why don't you take a seat right here?
Thank you. My name is Caitlin Kerrigan. It's nice to meet you.
You too. Let's get started then. So, what drew you to this career?
I was drawn to this career when I realized that PA school was the route for me. I feel like the education opportunities are more extensive, and it is a good medium between nursing and medical school. I feel like it's exactly where I want to be. I feel like it has the same medical module and has a lot of similar concepts as far as treatment plans go, such as um, things like different types of medical school and nursing schools. So I feel like it is definitely the route for me. I'm excited to expand my knowledge, and I feel like that's where I'll get the best knowledge to treat my patients the best. And I chose the route of emergency medicine because I have cared for many patients over time, and I feel like it's the ones who are in need um, during the most unpleasant moments like tragedy, disaster, accidents, or simultaneous um, illnesses. I just feel like it's definitely something that will always be in need, and it's something that I'm very passionate about and feel like I'm equipped to do.
So, with so many options available, why did you decide to apply to our program?
So I decided to apply to your program because after reviewing your mission statement, course load, and touring your campus, I decided that you guys had the things that I considered my top priorities. I really enjoy knowing that your program prioritizes patient care number one over anything. That you guys definitely advocate for the patient, and that's what you teach to your students. And a lot of PA schools don't advertise that. I definitely want to be an advocate for my patients. I want to know how to best care for them, and that's really what we're all here to do. It's not about me, it's about the patient. And I feel as though your course load, you had classes that were a little bit different than the other PA schools that I noticed. Yours was very interesting and something that I was just most excited when I looked at.
With all that being said, what would you say your greatest weakness is?
I would say my greatest weakness is my confidence. I feel like I know what I'm doing in work, in school. I know the answer. Um, I know medicine, and it's sometimes you care too much about what other people think and you second guess yourself. But I'm definitely working on that, and it's something that I will further work on in your program because it is definitely getting better as I work through it, but it's definitely something I need to continue to work on.
So, then why should we select you?
I feel like you should select me because I have a lot of experience in this field and I'm very passionate and motivated. I feel as though with my past jobs as a CNA, a CMAA, a pharmacy technician, an immunizing technician, and as an emergency medical technician, that I have a lot of background and basis of medicine, treatment, um, all of the anatomy, physiology. I definitely, and I know how to work with patients, and I make patient care my number one. Um, and educationally, I feel as though I'm very equipped to apply the knowledge that I obtain in school to my jobs. And that's something that I'm definitely very motivated to do within your program as well.
So, on a bit of a lighter note, what do you do outside of work or school in your spare time?
I love to work out. I love to be active, stay outside. In addition to those things, I also have spent some time job shadowing. I've job shadowed a few different PAs and doctors to see kind of where I want to be. And that's when I decided on emergency medicine and just kind of get a little bit of background on the workflow as a PA. And then I feel as though my volunteering is something that I do spend a lot of time doing. I volunteered at the American Heart Association, Mid Florida Dermatology and Plastic Surgery, and at Advent Health Hospital.
What's your alternative plan in case we end up not selecting you?
My alternative plan, I do have a few backup schools. Unfortunately, I don't really love all of them as much as I love your program, but if given the opportunity, I would love to, if I don't get into this program, I would love to get another chance and maybe take some time to work on things that are suggested of me, and then try again the following cycle after working on said things.
So, what type of background do you have that shows you can handle this type of work in education?
I feel as though the background that I have that will help me get through this type of work in education is whenever I have been just in my education my whole life, I have had plenty of very, very packed semesters and workloads, and I just feel like I have always been able to handle it. I've taken, um, I took dual enrollment classes while I was in high school, and college classes in high school while working, while also job shadowing and doing clinical rotations. And then after graduating high school, I actually spent the past 4 years doing the same, doing my full college course load, which is about 12 to 14 credit hours a semester, in addition to working almost full time, multiple jobs. And on top of that, I have just been continuing my education by hands-on experience, such as volunteering, um, clinicals, and EMT program, pharmacy technician school, and all of that. So definitely, I've had some very packed times. Even while I'm working, I have had times in school where I've been in difficult classes such as organic chemistry 1 and 2, physics 1 and 2, anatomy and physiology 1 and 2, pathophysiology 1 and 2, classes that typically students will struggle with, but I have luckily maintained a 3.8 GPA and been able to balance work and programs on top of that and extracurriculars. So definitely something that I believe that I can handle and will be able to thrive in this program.
Well, that about does it. Thank you so much for your time.
Thank you so much. It was great to meet you. Let me
too.
know if you have any questions.
Of course.